Okay, so,
Oh, okay.
okay. Yeah, so
Think I
now we're
got it.
starting
Yeah.
our recording. Wonderful. Okay, so I'll start off with some of our objectives. So by the end of the session, participants will be able to contrast the climate realities experienced by veteran nurses, so those that have seen shifts in disease baselines, different types of environmental weather disasters, and long-term policy, as well with early career nurses on our panel. So we'll see a variety of different stages of people in our careers. And then secondly, we'll be able to identify actionable climate mitigation and adaptation strategies that can be integrated immediately into daily clinical community and academic nursing practice so that you're able to use the skills that you see from this session and apply them confidently based on your community population. And then thirdly, just access and utilize global and local open source resources tailored to different career stages, as well as advocacy that Millie will be touching on at the end of the session. All right, so like I mentioned, we're going to start off with a Mentimeter interactive session. So I just want to pull out where everyone is starting in their careers and what they know about planetary health and the connection between climate change and those weather events and our health, community, and public health and things like that. So I'm going to put a Mentimeter link in the chat if you can fill it out, and then I'll flip my screen over so that we can see the responses. And there's also a QR code that you can use to scan in. So, like I mentioned, I'm an early career nurse. So, for me, I'm actually week 2 into nursing. I'm still in my orientation phase, if I were to answer the question myself. But I'm seeing a lot of early nursing, 5 years in, mid-career. Someone said tired, understandable, or retired, I see. 30 years, 50 years in nursing, all excellent. And maybe you can add what field you're in, or what field you or specialty you want to go into if that's something that you're interested in. Remote, psychiatry, comfortable, nice, expert, nursing professor development. Did everyone get a chance to respond to the Mentimeter? Okay, wonderful. Someone in the chat said retired PACU. Nice. Okay, and then the second question that we have is we want you to rate your level of comfort for the following climate and health concepts. So a few of the three prompts you have, it's a scale of 1 through 5. So the first one, identify how climate change impacts patient pathology. So heat strain, for example, or patient outcomes, you can also say educating patients on environmental risks, and then advocating for green and sustainable practices in workplace or at school for any students that might be joining as well. Okay, I think most people are around four, um, or three-ish, 3.5 for advocating for green and sustainable practices in the workplace. And yeah, around three or four for both too, the other two. Cool. Well, thank you guys for participating. This was just a way to kind of see where you're at in your nursing journey and things like that. And I'll transition back to the PowerPoint. So, what is climate change? I always feel like it's good to start these sessions with the raw data or the science behind it. Because as someone that's, in the planetary health and environmental health type of field, you might be approaching people in healthcare or even other sectors or other disciplines in the workforce that completely don't understand or know what climate change is. So I like to start off with that. So, based off of the United Nations definition, climate change refers to a long-term shift in temperatures and weather patterns. And since the 1800s, human activities, primarily the burning of fossil fuels, coal, oil, and gas, have been the main drivers of climate change and kind of accelerating the degradation of our planet integrity. So I like to break it down into two different type of scenarios where there's the climate shocks and then the climate stressors. So considering your own environment, I'm sure you'll have examples where you see these too. So I'll start with the climate shocks. So when you are, just existing, you're going to experience climate shocks when it comes down to where there are multiple days where it's over 90 degrees. Here in Minnesota, we've been having a lot of days over 90 degrees. And we typically have, all four of our seasons are pretty strong, if that makes sense. But the extreme heat is definitely an abnormality, and people start to feel it and can lead to community shifts, even socially, before we get into the impacts in our health. Our winters are much shorter or are much lighter than normal, where you're getting less snow, less days that are actually under 30 degrees Fahrenheit or 0 Celsius. And that's another example based here in Minnesota. One large rainfall that happens, very dramatically, or a thunderstorm, or if you're experiencing a tornado, for example, those are both things where it's a shocking event that happened that day, and you're not really expecting that type of thing. Whereas for climate stressors, we're seeing days that are 35 days, for example, that are scattered throughout the year above 90 degrees, a 10% increase in the days that are above 32 Fahrenheit. Kind of like I was saying earlier, it's not something that you might notice on a day-to-day basis, but when you're reflecting, you think, our winter, or we had not as much rain last year. Our winter was more mild than normal for Minnesota, for example. And yeah, maybe 1 inch of rain 5 to 10 times a year, or we're seeing more wind more regularly, for another example. So the connection between climate change and health really has many underlying drivers to say. So climate change together with all of the natural and human-made health stressors, it influences our human health and disease in numerous ways. So some existing threats will intensify and new health threats will emerge, but not everyone is equally imposed to this risk, to also say. So there's many important considerations known as the social determinants of health, which I'm sure many of you have heard of. So you consider age, economic resources, location, where people are based and how they've gotten to where they are is not by chance. It's a culmination of different factors that puts you in different kind of categories of how the weather affects you. So in the United States, for example, public health can be affected by disruptions to the physical and ecological systems, so including disturbances originating here or elsewhere. And the health effects of these disruptions include respiratory and cardiovascular diseases, injuries, and then premature deaths related to extreme weather events, and changes in the prevalence and geographical distribution of food or waterborne illnesses as well. it also poses a threat, either vector-borne or through toxic exposures, extreme weather events, like I gave an example earlier, and also food quality. So when you take all of these underlying factors, and then we have the environmental changes, and I got this graphic from the Planetary Health Alliance, which is a wonderful resource for learning more about planetary health and even a good online academic community as well. You get a lot of the causes, so the proximate causes, like I mentioned, the food quality, extreme weather events, etc., and then also consider the social determinants of health, so our ethnicity, race, gender, wealth, our governance, and then our social economic status. This is where we see those direct health impacts. So, infectious diseases, nutritional diseases, non-communicable diseases arise in them, direct injuries, child and reproductive health, and as well as mental health stress. Again, when there's prolonged changes to our weather environments that we're not used to, even before we start talking about the effects that it has in our bodies, our mindset and our social structure changes because maybe we're taking social sacrifices because if the air quality is too poor, and say you have an asthmatic student or someone that's just immunocompromised, they're not able to go outside to, play softball or baseball or something because they have to move indoors. So they cancel that. They lose the physical aspect of recreation and entertainment, as well as the social aspect of communicating with other people. And I think especially because of our post-COVID era, we're seeing that it impacts the way that we socialize with other people, and it can create more loneliness as well. So, uh, that was just kind of like the background to understand how climate change really affects our human health. And now we're going to transition to our panelists. So, I'm going to give a brief bio for everyone here. Again, my name is Yvonne. So, I'm doing a internship with Annie this summer, and I'm also a new grad nurse. I just graduated from the University of Minnesota, Twin Cities, from the School of Nursing. And I'm starting out on the cardiac observation floor within my hospital, which is Alina Health. Um, and yeah, like I said, I'm only week 2, so I'm still doing orientation and shadowing and whatnot, but I'm very excited to see what the career brings me. And I've had a lot of experience within the Planetary Health Alliance and different types of sustainability and environmental type of policy work and public health work as well, whether it's presentations or different conference opportunities as well. So I'm happy to be hosting this session. So next, I will introduce Millie. Is it Elia or Elia? Millie.
Elia.
Elia. Perfect. Thank you. So Millie is an advanced practice registered nurse. She's an early stage researcher in the environmental impacts of climate change on patient care and the program manager of climate and clean energy at the Alliance of Nurses for Healthy Environments. She co-chairs the National ANA Innovation Advisory Committee on Planetary and Global Health, as well as the ANA New York State Chapter Climate and Health SIG. Millie is also a fellow of the American Nurses Advocacy Institute, in which she focuses on building awareness and developing educational toolkits on the impact of climate change and patient care outcomes. Our next panelist is Miss Manalita Dayan. So please welcome her. She is a retired nurse, leader, and advocate for 50 years of clinical and research experience, including extensive work at the University of Chicago's Comer Children's Hospital. Manalita currently chairs the Philippine Nurses Association. Oh, excuse me. So she currently is a chair for the Philippine Nurses Association of America's Task Force of Climate Change and Public and Population Health, and she frequently speaks and advocates for climate adaptation and mitigation strategies from across public health. Our next panelist is Claire Tumaghap. We're excited to feature Claire, and she's an innovative nurse at Corewell Health, where her career spans everything from robotics in the OR to chronic disease management. So during the pandemic, she helped pioneer the COVID communications program across three hospitals campuses to help keep ICU nurses connected to their families. And today she leverages telehealth and digital technology in outpatient care to improve patient outcomes and streamline care navigation and keep patients out of the hospital. And then lastly, we have Miss Dominique Dastillo. So she's rounding out our panel, and she brings in kind of the student perspective. So she's an implementation coordinator at the Center for Health Disparities, Innovations, and Studies, and an MS candidate in nutrition and dietetics at Eastern Michigan University. So Dominique's U.S. Climate Alliance funded research explores the intersection of household food waste, nutrition, and environmental sustainability work. So she'll be representing the FNCE in 2026, and she's dedicated to advancing health equity and sustainable food systems, um, especially in underserved type of communities. So, as I've described earlier, we have known that climate change does have great impact on our health, differently depending on where you look. So we have Manalita, who we has this national and global policy level experience. Claire may see it in the hospital floor at Cornell, and Dominique is a student and academic community member. So they all bring unique vantage points. So my first question for our panelist is, what is the most urgent climate-related health issue you are witnessing right now in your respective spaces? And I will allow you guys to, whoever wants to go first, may unmute.
Okay, I figured it out. Okay. Unmute. All right, I got it. I think so from a hospital perspective, I think a very um, realistic point of waste every day, unfortunately, is the single-use items from the hospital. Obviously we want to keep infection rates down. We want to keep the, patients safe. We want to make sure that everybody, infection control down. We want to make sure that everybody, we don't spread any diseases. We want to keep everybody safe and, hygienic. But at the same time, we're wasting plastic. When you work in surgery, there's a high amount of plastic and, waste. Um, that is one of the most important things. But also, what we can do to help combat that is for, you know, items that are not used, even if they're opened, there are programs like the World Medical Relief that do take items, and it's nice that they are reviewed for obviously safety and hygienic purposes. That they are reviewed, like if a pair of sterile gloves weren't used during the surgery and they were not touched, they were not contaminated, those gloves are sent to the World Medical Relief, distribution. They're organized and then they're sent off to third world countries for their, you know, reuse. That is one way, we could reuse those single use items. Again, it just hurts my soul to always just waste everything. And then even working at bedside, sometimes the hospital corporations, they do put pricing on how much it costs to even reuse or how much it costs to wash towels. Like it'll say, how much it costs to wash the scrubs, just so we're aware, to keep environmental costs down as well. So that's one of the things that's been pressing, environmental wise. So that's my 2 cents.
That's very true. Yeah, there can be so much waste, especially in those surgical rooms where, everything has to be sterilized, washed again, for every surgical procedure.
Well,
Thank
I
you.
echo.
Yeah, I echo Claire because I also work in the post-op, and you know what? We use too so much. They told me that for a year we spend like 500,000 just to wash our bed sheets because we have to change it all the time. But I think the most important thing for me right now is how to mitigate and how to adapt to the changing climate, especially here and in the Philippines, especially in the Philippines. Uh, changes in the temperature. It's too hot. I just came back from the Philippines, and it's just so hot in the morning, and in the evening it will be flooding because of torrential rain. And you know what? It's hard to how educate the public to for their children to avoid being using the flood water as a swimming pool. I am sorry, but that's what happens. So I really what I want to do right now is just to explain. I wish I have bigger voice, and to tell the public that it's because of all those changes and all those typhoons and torrential rain, and oh, in addition to that, earthquake. We had the biggest one while I was there. So I really hope that everybody will be part of public education from all levels, from the school, from the public offices, to tell the public that this is what's happening right now. And for me, education is very important. My 2 cents. Thank you very much.
Hi, Dominique. On my end, coming from a nutrition background, it's interesting how there's so many different levels to these things because, as Claire had said, being in the hospital and then having the waste from the single-use items, things that we're learning is just bringing different food to people and when they don't eat it, or even in a long-term care, how much waste that's creating if it's not a made-to-order meal, which obviously still costs money, but teaching people, having them learn more about it, having diversion practices set in motion. So if maybe they only ate a portion of the plate, who can we donate this food to so it doesn't go somewhere else and create gases to then, affect the climate and send more people into the hospital. And that's all I have.
Thank you, Dominique. Millie, do you have anything else to add?
Yes, I do. Thank you so much. Because my work is not institutional based, I work on at the federal level. I would say that from my perspective, this administration's rollback on many of the policies that have historically been effective in progressing us towards cleaner air, and in particular, the most recent repeal of the endangerment finding, which had been around since 2009, a well-established um, um, standard in which greenhouse gas emissions were noted to impact human health. And so by repealing that along with clean car um, standards, it really puts everyone across the board at a huge disadvantage and works against all the progress that we have made. And so in my personal view, from my vantage point of the world, this is one of the challenges that we're facing.
Yeah, I agree. And especially in the past year, coming from a student standpoint to now actually entering the workforce, it really puts students at a high disadvantage when they're not able to seek opportunities, even in environmental internships or research opportunities, because the funding is completely wiped. I mean, they have to work essentially for no money, no compensation, which is terrible. Perfect. So the next question that we have is directed for Manalita. So through your leadership with PNAA and using like a bird's eye view, how would you say nursing has evolved and how have you seen the baseline of public health and patient illness shift over your career due to environmental and climate changes, particularly through it both at a local lens and a global lens, so considering the Philippines as well. And if anyone else would like to add thereafter, you are more than welcome.
Thank you, Yvonne. Good morning and good evening again to our global audience. And being part of the PNAA as the chairman of the Climate Change and Population Health Task Force, I'm in the front row seat to how Filipino nurses, both in the U.S. and in the Philippines, back home, are confronting a different kind of patient baseline than we saw 20, 30 years ago. Climate change isn't just an environmental issue right now. It's a nursing issue. And this is why, the patient acuity, it has changed a lot, because of the heat. We're admitting more and more elderly patients who are chronically ill, patients for because of heat, dehydration, cardiac events, and heat season now overlaps with flu season. The air quality, wildlife smoke from Canada. I know people from Michigan and even as far as Minnesota, and here in Chicago, triggers asthma exacerbation. Pediatric asthma admission spike on days we used to call clear. And also the vector-borne diseases, like Lyme, West Nile, and some of them are appearing earlier and farther north. What was a summer camp diagnosis is now a year-round education for clinics. In the Philippines, we have more typhoons and flooding. I just came back from Davao, and we have this flooding like almost four times every night, a week during the evening when it. Oh,
I think we lost her. Maybe her computer died.
Oh, okay.
So maybe, I don't know, because it just
I'll
went out.
yeah, I'll text her. Maybe another person can.
Yeah, if anyone else can also add, like, how have you seen nursing change throughout your career, or you can even do in school versus now, um, and how has the patient illnesses shifted based on the communities that you're based off of from a local and a global lens?
Okay, I'm gonna figure out this Zoom mute unmute business. I'm gonna become an expert by the end of this. Anyways, so I'm still I don't know, I'm kind of a baby nurse, but I mean I graduated like 15 years ago, so I'm one of the youngest board members on PNAM. um, so from I guess from the environmental perspective throughout my nursing career, um, I've noticed that the chronic illnesses certainly have become more prevalent. They become prevalent like earlier. They start early on. Um, so the younger like people, my patients are younger and younger, and they're just sicker and sicker. And with my background in during the COVID pandemic, I segued into the liver clinic, and again, patients are just younger and younger. So climate absolutely had an effect on that with the patients with their chronic illnesses. And as Tita Buang comes back, and perfect segue to go
I don't
back
know what
to
happened.
asthma and the children and the asthma, and I'm sure their illnesses are getting worse, you know,
Yeah, yeah,
more of it. So back to you, Tita.
I know. Yeah, I apologize. I don't know what happened. Maybe I haven't paid my, no, I'm just kidding. But anyway, so in the Philippines, we have typhoons and flooding and more of it. And, plus the erupting volcano, typhoons like the Yolanda and Odette and the recent superstorm and stronger and wetter climate storm recovery to repeat disaster management. So heat and humidity, nurses in the provinces report more ER cases of heat exhaustion, especially among jeepney drivers, the farmers and chronic kidney diseases of unknown origin, food and water security, flood cycles disrupt the crops. So right now we have part of the Philippines which usually are not being flooded. Now it's flooded. Public health nursing moved from episodic to continuous disaster. Before disaster nursing, you train, you deploy, you came, and then you go home. But now it's a core competency. It's part of the training, especially uh, climate health triage. We teach climate health triage because every locality is vulnerable. In Florida, it's hurricanes. In Chicago right now, it's heat and flooding. And in the region in Bicol region, it's typhoons and lahar. Filipino nurses in the diaspora right now also became the bridge after every typhoon. PNAA chapters mobilized donations, telemedicine consults, returning medical missions, and we're not just responding abroad, we're caring for displaced family members here who have hypertension, lost medications, and the baseline patient is now climate vulnerable. 20 years ago, we thought assess for chronic disease. Today, we assess for chronic disease plus climate vulnerability. Does this patient have air conditioning? Do they live in the flood zone? Can they evacuate? Something like that. So globally, PNAA Global Health Initiative see this most acutely, and rural clinics in the Philippines now plan for 3 months of meds pre-typhoon season. That wasn't the standard practice before. Nursing leadership also evolved with it. PNAH's role expanded from professional development to climate health advocacy. We are now collaborating with the Department of Health and, of course, the Alliance of Nurses for Healthy Environment and local health departments. We talk about climate resiliency. We talk about nurse-led community cooling centers, climate history nursing assessment. And so the bottom line, the baseline shift from stable season to unstable. Nurses are now first-line climate adapters. We still do bedside care, but we also do infrastructure, policy, and resilience building because the environment is now one of the vital signs. So that's what can I say right now, the difference from 20, 30 years ago, from when I started nursing, I should not say 50 years ago up to now. There's really a lot of changes happening, especially with the climate change. Thank you.
Yeah, that's wonderful. Thank you so much, Manalita. I like how you bring the example how our environment is becoming like a vital sign for us nurses. Even if we don't necessarily see it, it's like a written thing in the charts, we're seeing it how our patient is presenting to us because of these different environmental weather events. And kind of rounding out what Claire said as well, like we're seeing younger and younger patients getting more and more sick. I think for me, it's becoming more shocking just because, um, my own community, I don't necessarily see sickly people all the time, but now I'm entering the hospital system and you're just seeing young people that are very sick and maybe they have different social situations where they're not able to get out of certain living environments or certain environmental hazards. One example that just comes to mind now is here in Minnesota, we have a trash incinerator, if you guys are aware of those. They burn a lot of trash, and ours is located in northern Minneapolis, which is where most, it is the most people of color, so Black and Indigenous individuals live in this neighborhood in northern Minneapolis. And the trash incinerator is located here, and it brings trash all over from different suburbs, different, socioeconomic statuses, and it's burning it daily. And the air particulates in that area are particularly bad. And it's something that they have to breathe in. And if you're someone that has cardiovascular diseases, diabetes, respiratory diseases like COPD, for example, just living in that environment, you may not be able to thrive as you would because you're getting more sick. You don't have the ability to go to work or go to school. And also too, I like that Manalita brought up the point of how education is a good is a key factor for our communities because I'm sure many people don't even know that the environment that they're living in is harming them, which is why it's so important to understand what this connection is and how we can make changes in our personal local communities. So, our next question is for Dominique. So, as a dietetic student at Eastern Michigan University, and considering planetary health and climate change curriculum, how has becoming more visible, how is nursing, is climate change and planetary health becoming more visible in curricula? And then what are early students learning today that older generations might not have had, and how does eco-anxiety impact your generation of nurses entering the workforce? And I know you don't particularly have the nursing background, but from your perspective, from food habits or even research based, what have you seen?
Hi, Yvonne. Thank you so much for that. And actually, I take a lot of the same like prep classes to get into my major. So,
Hmm.
yeah. So one thing I've noticed is that we are being taught to think about health in like much broader terms than just treating illnesses. We're learning about things like air quality, the climate events, food access, and even how food waste like have impact on patient health. These are conversations that are more like integrated into classes in our education because I've had in a couple of classes we've had projects that are talking about our carbon footprint, like what choices we're making each day, be it like walking to the store or driving to the store, or what food choices we're making, or even single-use item choices, and kind of like adding those together just to know what our singular impact is on yeah, on the world. And then as a nutrition student, we're thinking about things in more of a broader term as well. So it's more about like where the food comes from, how it's produced, and how much gets wasted. And as Manalita mentioned, we're learning more about social determinants of health. So having projects on that and really, it's one thing to say it, but it's a complete another one to like understand that and understand the different effects that has in many different levels. Um I do think that a lot of students experience eco anxiety, be it with what has been going on in, the past week. We read about climate change and it's easier to understand when we look outside and, the air looks different, but even just understanding the choices we make when it's not like that. Um, so yeah, and then also wondering about what's going to happen for the people we're caring for now if we don't make those changes. Like you said, with people coming in even younger, what is their quality of life going to look like if we don't make these changes? So and something I like to, because I'm really passionate about, climate, about recycling, about trying to like make things better. I like to use an analogy of like it's kind of like recycling. Like you have the options there, but knowing how to actually utilize them, like knowing what to put in each thing. Even with, how Claire had said single-use items, maybe knowing the options of maybe not opening things if you're not sure if you're gonna use it. Just giving people more education on what choices they really have. So with that being said, and with us learning more about these in our classes, I definitely don't think that we feel hopeless. If anything, it motivates me. I've even had, like people in class having their research product projects being about how to make less waste and like what different things they can do working with nurses, like if someone has training on how to do things or like serve things out differently. So yeah, making like practical ways of making healthcare like more sustainable And yeah, I personally am excited, but I think just knowing other people are choosing to have projects based on that, they're excited as well.
That's great. Thank you so much, Dominique. And I also think too, to add from a student perspective, when you have like mentors that you can rely on and different opportunities that you're able to take on, and also just having that passion for whatever your niche is. It might not even necessarily be planetary health, but there are different social determinants of health from, all aspects that will affect your patients. So understanding what the best way to communicate that resource to them, whatever it may be, which I'm going to show a sustainability toolkit thereafter the panel, I think is a wonderful idea, especially just, entering the workforce. So the next question that we have is catered for Claire. So, Claire, working within a major healthcare system called Corewell Health, you see many day-to-day realities of hospital operations. So, what are the most immediate practical areas of waste, or the most immediate practical areas of waste or inefficiency that you see from a daily practice? You kind of touched on this earlier. And then how can frontline nurses start tackling them from waiting, instead of waiting from top down management approval? And I kind of had another question for you as well. I'm not sure if your hospital has this, but are there any committees or what is the best way for a nurse, I guess, to advocate for themselves for their patients within the hospital setting that you have found?
Okay, so let's break that question down. So I guess, sorry, let's go back. So the first part of the question was from, I'm sorry, repeat the first part. Let's do
Yeah,
that.
yeah, no worries, no worries. It's kind of a long one.
Yeah.
So from since you are within the healthcare system and you see the day-to-day realities of hospital operations, what is the most immediate or practical areas of waste or inefficiency you see in daily clinical practice?
So again, the overall vibe is the single use items. But again, risk benefit, infection control, convenience.
Hmm.
There really is no way around it. Gloves. Obviously, that's got to be single use, but we do have to be uh, conscious of, you know, let's not waste. Let's be aware of when we're going to use gloves, when we're not. But certainly, you know, do we need to use sterile gloves for a certain procedure? Absolutely. Do we need to use the super expensive gloves for, the super expensive sterile gloves for a non-sterile procedure? No. Is it a personal preference? Yeah, but at the same time, let's be aware, if we're going to keep costs down, let's, risk benefit. So there's that. Again, the within the hospital system, again, it's just the waste, but risk benefit, and there's lots of other things, again, from top down that we can't control. But to advocate for the patient is always the number one thing. And if that means spending a little bit more or wasting a little bit more to benefit the patient, then yeah, you take that risk. In regards to advocating for the patient, and instead of waiting for corporate to make that decision, yes, there are two. So this is my personal comment. So I don't represent Corewell Health in this situation. I just work for them. But again, this is my personal comment. But yes, we are working towards unionizing with our contract. So that's in the works. But yes, that is available if we would need to advocate, or um, there's always an option to discuss we are always encouraged to discuss with our manager directly, but if we need to get the union involved, there's always that option. So we do feel protected always to have that discussion with people, in the workplace. But yes, if it means advocating for our patient, then yeah, certainly we're going to do it. But again, it does come down to risk benefit and keeping the waste down. So
Yeah,
yeah.
that's very true. Like, at the end of the day, not all waste can be eliminated from a hospital. Like it's not actually possible. But I like how you were explaining how um I guess kind of the education behind it or knowing what is absolutely needed for certain things. Like do we need sterile gloves to do, like remove stitches or something like that. And I think the more you share that with nurses, the more efficient they are with using supplies within the hospital. So the waste goes down a bit. Um, great. And then the next question is for Millie. So what are methods through Annie that advocacy can be given to nurses across sectors?
Thank you so much. So Annie really, as an organization, we're the only national organization that focuses exclusively on the intersection between environment and health. And so that's important to know to conceptualize what the answer to the question. As that organization, that leading organization, we work really hard to equip nurses across all sectors with practical advocacy strategies that really advance and move forward environmental and planetary health. So the methods we used include educating nurses so that they can then educate their patients, empower their patients, educate them so that they can laterally educate peers. And as well as go into the community, most of us as nurses, at one point or another, have gone into our community to help educate or provide resources, whether that was at a vaccination site, whether that was at a church center, or some community hub in order to provide educational resources. We engage heavily within our communities. So we're really looking to empower our nurses across the board to then take that out and bring it into the communities across with their colleagues and to their patients. And we do this under the context of climate-related health risks. And we also encourage nurses to really engage in policy advocacy. And so that looks like meeting with legislators and signing on to public comments and sign-on letters, and collaborating as well with interdisciplinary and community partners to address environmental challenges. So in this particular, nursing does in the space of environmental health, silos do not serve us. So as a nursing profession, we have that expertise, but we need to reach out and really go into dialogue with community stakeholders who have other expertise. We're talking about your patient representatives. We're talking about your local leaders, and be in communication with them. And so that may also look like integrating uh, working towards advocating, integrating sustainable practices within your care setting, whether that may be in home care, within the institution, within the community clinic, and even in academics. How do we teach our students within research and within general healthcare systems operations? And we do this by using evidence-based communication through presentations like this, in which we collaborate with valued partners, such as the Philippine Nurses Association, and media, social media, which is a huge area to leverage in this kind of work, as well as publications. And we do this with the intent of raising awareness and influence with an eye to influencing decision makers at every level. So together, all of these approaches, again, really we're working towards empowering nurses to advocate for healthier patients, communities, and environments at every level, the local, the state, the national, and yes, even the global.
Thank you so much, Millie. And then the last question that we have for all of our panelists is if a nurse or nursing student leaves this webinar tonight feeling inspired or overwhelmed, what immediate advice would you personally give, or what's a practice that you actually use in your home life, work life, school life that they can take to their next shift or their next class to champion climate resilience?
I always like to think of things as like making one small change. So making it, being sustainable as in the earth, but sustainable changes. Big problems can always seem overwhelming, but even just, looking online or going to any of the resources that we have available for them, to be like, how can I make a difference? Even if it's, like again, recycling different, or if you go somewhere and you're taking a little less food because you know that you might not eat that much. If everybody did that, that would make a big change. And it doesn't seem, it's a small thing that you can build off of. Once you get used to that, then it's, looking at other things and then also bringing that up to the people around you that you work with, that you're in school with. That's my point of view.
Thank you. Are there any other perspectives?
Got it. My unmute. I'm telling you, every time I need, just getting faster and faster with this unmute. Okay. So, my hot take on this is with technology, it can, and I'm as a remote nurse, a telehealth nurse, I'm always, um, encouraging patients that yeah, technology can be our best friend, but all could also be our enemy. Within reason. So, like when the weather was horrendous last week or a few weeks ago. I don't know. I've blocked it out already, but we, encourage our patients to switch over to virtual because it's still important that they're seen. It's still important that they're touching base with the provider versus not at all. So we want to offer that as an option instead of them falling off the grid for months and months and thinking that there's no other option for them. So just having that telehealth access for them is important. And then another thing to help with the environment and climate change is to always just think, because I have two little ones, I'm just thinking, okay, what can I do to make, and they're like making noise upstairs too. They're home now. So, but again, to just think like, how, oh, and they're coming down the stairs. Hi. Okay. Hi, that's my little one. Ollie, say hi. Hi. So again, that one, there's my 8-year-old. So whatever I do, I'm always thinking, how can I keep, this environment, because we're passing it down to them, right? Okay, goodbye. Anyways,
Can I say something about
Yeah, go ahead.
the education about telehealth? You know what? Our generation, not all of us knows how to even turn on Zoom or we have to be educated. My well, not everybody, of course, but among the our generation, I would say telehealth might be. I think we have to be re-educated on how to even how to access those information through telehealth. It starts from there, and you know what, we nurses, because we are all over, I think we're the one who can help them, and help them, educate them to how to access all this information through without leaving our homes. So I think educating the public about uh, AI, something like that, and then explain, and then and it has to be reactive, interactive, because that's what we need. Um, I don't want to be told and just and then somebody talk to me, da, 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 and then I won't be able to ask question. I want something, a system that when I turn it on, I'll be talking to someone and someone can tell me what's going on, not not the one that's already there and I just have to read. And some of us will have a hard time reading also. So yeah, we have to be educated on how to, first of all, what are these what are the ways we can access, all this information without leaving our homes.
And I would just add, if that's okay, very briefly, that I relate to this question very much. My background is as an oncology nurse practitioner for well over 2 decades before transitioning into my current role. And I can tell you that I was that overwhelmed nurse who understood that there was an issue with climate change, and how do I relate that to patient care, and what are the first steps? And I encourage every nurse at every level, whether you're well seasoned or early career or even a student, to um, make the next step, find your community. So PNAA, by offering this webinar, is a phenomenal touch point to all of your members. Outside of PNAA, are organizations like my own, Annie, free to join, a wealth of resources. And yes, for those of us who are, very seasoned in nursing, decades and decades and decades, technology is not the easiest. So when you have nursing organizations that represent you, having the ability to tap into the education there, maybe that looks like the monthly dinner invites. I know in oncology nursing we would always do a monthly get together for your chapter, in person or via web if that's your choice, but asking for those resources and then looking for nurses in other organizations, again, like Annie, that embrace this world and can offer next steps to you.
Good. Oh my God. Oh, it's over. Having a problem with
I am my May I say
Yeah, go
something?
go
Yeah.
ahead.
I really honestly think that climate change should be part of the curriculum. I think I just graduated from my master's, so I'm waiting for it to be part of the curriculum because it's very important. It's here and it's happening. So if it becomes that, everybody will be prepared. I really wish it's part of educating the community, but it has to start from us, when we go to school. I wish that it can be integrated already in all the curriculums, whatever subject they're in, whether they're going into nursing, whether going to engineering. It has to be part of the curriculum, even in high school, even in elementary. It can be done. So I wish within this lifetime it will happen that climate change will be part of the curriculum.
Yeah, I agree. And I feel like within my own university at the University of Minnesota, we were slowly starting to see that the connection of our environment and community-based health were more instilled into our curriculum, and more than just, like one slide on a lecture thing. It was actually something that was integrated that most students can say, okay, I've learned something about this or this social determinant of health. So thank you so much for sharing that. So that brings us to the end of our panel, and I just wanted to take a moment to share our sustainability toolkit. This is going to also be a part of the post-CE quiz, but I think this is a great resource for nurses or anyone in the healthcare system to to figure out what type of area do you actually want to bring change in. So let me just take one moment to pull up that
Yvonne,
website.
Yvonne, before you pull out the website, there are two
Sure.
questions in the chat box for the panelists.
Um, oh, sure.
Yeah. The first one is I think Miss Manolita and a couple of the panelists tackled on this one. If you could identify one area where nursing is least prepared for the effects of climate change, where would it be and what we should prioritize to close that gap?
Can I say something?
Sure.
Hello, Miss Marita. Thank you for your question. Um, I think we're already, we are so good at and responding to responding to code blue or code red or codes, but we are very least respond well responsive. We're least responsive to something about climate change, and we are least prepared for, like in the Philippines, infrastructure failure during the care. We have a lot of hospital blackouts. Did you know? And I experienced that during heat waves. No water for dialysis, for example, no water for, especially after floods, and supply chain collapse, cutting off medications and oxygen, and we drill for mass casualty, not mass system failure. And here in America, I just think the climate, we are slow on climate linked mental health problems, like PTSD and climate you know ch- especially among kids. Most still most of the curricula still treats mental health as separate from environmental health. So I think to close those gaps, it's very important for educating the public. It is really put climate change in every nursing competency. I think will help a lot to close that gap. To integrate climate health assessment into nursing fundamentals. Let's say, BP, temperature, pain.
Oh,
Oh, you muted
you're
Manalita.
muted.
What's the matter with my computer? I have the brand new one, but I apologize. So I'm saying that education and put climate change, climate in every nursing competency, and maybe integrate climate health assessment into nursing fundamentals, like part of the vital signs, BP, temp, pain, and climate vulnerability. Then we will know, how to take care of these patients when they go home. It's education is really a very big thing that we can do for the public. That's my answer for. And thank you, Miss Marita Rio.
I don't have much more to add on to that because Manalita did such a fabulous job, but I agree with the education as well. And especially when she had said education in every aspect, not just nursing, but engineers, like all different types, just being, bringing it to the front and making it aware, and also treating, learning about climate change as preventative health, because it does, when people make different choices, does prevent other climate, things from happening. But that's it. Thank you.
We have another.
I
Oh,
do agree
sorry.
with the prevention. Yeah.
Oh, sorry.
Yep, go ahead.
The other question is from Miss Reglita Lapot. What interventions will you recommend to minimize the effects of climate change?
May I say something about that? A short one only. Thanks, Reg. I think Reggie. I know her. That's why I call her Reg. Yeah. Intervention, you know what? First of all, we have to accept that climate change is happening. Then educating everybody in what we can do as nurses, all aspects, for engineers, for everybody, what else they can do to minimize the effects of climate change. For nurses, like what Miss Claire said earlier, in operating rooms, like Miss Dominic said earlier, the disposables, the waste that we can minimize waste. For engineers, they can probably, well, I'm thinking of something, but I cannot think right now, but I'm sure they can do something also about climate change, making, or for, at least, stop stop cutting our trees, something like that, to minimize cutting our trees. But now, you know what, we try to plant, but the planting of trees right now is not enough anymore to catch up with the greenhouse effect anymore. But we can do something in our everyday life. I'm sure we know that. But first of all, we have to accept, because some of us still don't accept that they say that it's part of ecology. It's part of, it's going to happen anyway. But you know what? It's happening, and we feel the grunt of this climate change, the heat, the all these disasters. I don't know how long will it take for us to do something, for everybody to do something about this. So I think educating, educating the public, giving it, maybe put it in all what do you call this, the um every in the in when we're watching TV, it can be done through advertisements. We see it in what do you call this big boards, while we're driving. So something like that. I don't know, there's so many things we can do, but we just prefer to be comfortable next to our air conditioned room. But not all of us have that, have that accessibility to all that, things that we can do. But the very, very important thing is educating, accepting, educating, mitigating, and uh, uh, adapting to this climate change. Thank you, Reggie.
Yeah, thank you,
Thank you
Manalita.
all.
I would like to add from a consumer perspective as well as from a school perspective. So my kids, they have a recycling program, like with the grocery bags. The more they collect, they get to essentially like um, I think earn credit or earn money, depending on how many pounds of plastic they collect. So that's good fundraising essentially for the school, and it costs the parents because my kids are in private school. So anything to help the school helps the parents. Any fundraising that we can do obviously helps our wallets. And that's our choice to send our kids to private school. So again, anything that helps us helps the environment, so anytime I get an Amazon package, which again, Amazon is a whole nother beast. But anytime I get, groceries, I'll save all the plastic. I'll actively remember to save the packaging that cannot go into the recycling. And I'll just remember to send it with the kids when I do the drop off, and they know which box to put it in. And then again, the school will submit that, and then they just keep track of how many pounds of plastic they get, and then they get a check cut for them, and then that's their fundraising. So then from a consumer perspective too, it's good to choose companies that are actively involved in reducing um, you know, waste and recycling and choosing responsible products. So that's one way, one intervention that we all could participate in as well. So that's
May I
my.
say, may I say something also? I just came back from Japan, and
Oh,
there are no waste receptacles in Japan. None. Everybody, they bring their uh whatever, their uh wrappers home, so they will know how to recycle them. You won't see anything yet. There's no uh there's nothing. That their streets are clean. So I wish we can do that. If because when we go picnicking, everybody using this waste receptacle and it overflows and nobody takes care about that. Nobody cares about that, and then we blame the government because it's wasteful waste everywhere. But you know what? Yeah, that's what I just noticed in Japan. They don't have. I was eating candy. I mean, and I cannot find a place for my wrapper, and so that's another thing that probably we can do. But I don't know if that's. I think it takes generations for that to happen.
Yes, I agree. I think the best way to summarize what you guys have all have added is there needs to be a cultural shift to how we're um, taking in these climate changes and how it's affecting our family. And actually, I mean, if you really think about it, most of us are already using different methods towards resilience, and it just isn't necessarily highlighted or um, it's not like a blatant thing that you're thinking about every day, but it's just our way of surviving. So I agree when we have that education from a very young age to all students that, okay, like, XYZ is happening, and this is how it affects our bodies, our health, our social status, etc. That's when that they can incorporate it into their lives, into their homes, and actually continue that. That practice and despite any discipline that they're in, it can it affects everybody. Are there any other questions for our panelists? Maybe we can go to the Q&A session now, and then I can show the sustainability um, toolkit at the end. You can unmute if you have any questions for the panelists.
Nothing in the chat box right now, Yvonne.
Okay. All right. Well, this is our planning committee. So this is me, environmental intern. Kara wasn't able to be here today, but she helped me with the planning a bit as well. She's the deputy director of Annie. And then we have Millie, who's the program manager here and she specializes in climate and clean energy advocacy, especially at the policy level. And then from PNAM, Claire, and then Dr. Miriam, the president for Michigan chapter. And like I mentioned, the continuing education will have one contact hour for all of you. We're going to send a follow-up email to all the registration members where they will receive a code to verify that they've watched the webinar. And then there's a 5-question quiz that's associated with it. And you'll receive it from Kara Cook I guess next week now since it's Friday. So, yeah, that concludes our session. I thank you so much for participating and thank you to our panelists. We are so thankful to have such different diversity of backgrounds and pulling this all together in like, maybe a month's time or less than a month's time. But it's been a joy to learn from all of your different perspectives in your careers. So thank you very much. And thanks to the participation members.
A couple of items. There are
Sure.
2 attendees who need to identify themselves. I think they're on the phone, Lola's phone, and also there's a phone number. We need your name, your actual name, so we can send you the email address. Oh, okay. So Noah also said he's the one on 773. Thank you, Noah. I'm
Yeah.
only need Lola's iPhone. She's the only one that I need, or she or he. Okay.
Okay, we'll do this again next time.
Yes. Thank you
Yeah,
so
we'll do
much,
it next
everyone.
time.
Yeah.
Thank you.
Thank
Thank
you
you.
very much.
Oh my gosh. I'm going to figure out Zoom. I swear. Okay. Bye, everybody.
Yeah.
Hi,
Bye.
Claire. Thank you so much.
This
Bye,
was,
Claire.
thank you for
Irene.
a great job.
Thank you, Yvonne.
Yeah, no problem. Thank you.
Are we gonna stay,
Oh,
Yvonne,
Yeah,
oh,
or
you guys. Okay, bye.
yeah, yep,
Miss Score.
that way.
Okay, quick.
Yep.
How did we
Hold on a
do?
sec. Hold on a
Score is
sec.
still
Let
here.
me. Yeah, I'm just gonna put the.
Miriam, your sound is a little bit
Oh,
I
I
don't know,
don't have
maybe
my.
just my sound.
No, I
Oh,
don't
there
have
you go.
my.
Your
I don't.
thingy.
I moved my
My
earpiece
I
somewhere.
see.
Yeah. I
So
just wanna make sure. Oh, there's Boots.
Yeah, I'm
Boots,
here.
hi Boots.
I'm
Thank you
gonna
for
put all
thank
of
you for
them.
being one of us, Boots. Thank you.
Oh, I'm always interested. This is something new, you know. We never had this in the
Oh,
so
we
that's
I want to
good.
always
know.
I'm glad
we
you found something new. That's so good. I mean, that's the
Yeah.
point, you know?
we
Yep.
will yeah, we have to pay a bill we have to pay we have to get a billboard that says something about climate change.